and Matra Bastis you can use. That is, that's Rasayana type of Bastis. Then there you can give Muktadi Rajayapana Bastis. So it is a Rasayana type of Shira Bastis. Shira Bastis are Rasayana type of Bastis. You can give such Bastis to strengthen the apparatus after the surgery. Then Dhritas, I told no madam, list of Tailas and Dhritas are enumerated. So many Dhritas are there. What we can use, Vrishya Dhrita, Shivantyadi Dhrita, Triphaladi Dhrita, Shira Drumadi, Shiri Drumadi Dhrita, Asana Bilwadi Taila. For Abhyanga, Asana Bilwadi Taila is good in the Shiras. Manjishtadi Taila, circulatory galaxy. Then Tunga Drumadi Taila, Chandanadi Taila, Pitta Shamaka, Baladapri Adi Taila, again Pitta Shamaka. Then other Upakramas in Ashtanga Sutras, Timira, this is related to Dharna Tivra. Kshira Duma. Kshira Duma is also indicated in some of the Pal Pugam is told in Kerala, but not in the eye disorders. It is in the neurological disorders.
Pakshagata we do.
Pakshagata in Ardita also some changes in the eye. Then,
Ardita only, Bell's palsy.
Yeah, Bell's palsy. And even the sixth nerve palsy also there, no? Yeah. There also you can use the Kalapugam. Kalapugam is called Kshira Duma. There's Masha Baladi Kwata. The Kwata children is Masha Baladi Kwata. And milk. That steam is inhaled. Steam is inhaled.
Even Dashamula I used.
Similar to Masha Baladi Kwata is particularly mentioned for. Masha Baladi Kwata. Or Balamula. Just if you don't get Masha Baladi, at least Balamula.
It's available here.
Dashamula is different. Balamula is different. Bala Sida card is for here. Balamula. And Bala is always considered as a vasodilator. Vasodilator, Bala. Vasodilator, Bala. Shira Bala is like you put it a blood vessel disease. It's a vasodilator, Bala. Masha Baladi Kwata, Kshira Duma. It's the milk. That is, the steam is inhaled. For neurological disorders in and around the eyes you can use, but you should protect the eyes while taking the steam. Should protect the eyes. Then Murdni Tailas. Next other important are Murdni Tailas. Shiro Abhyanga, Shiro Pichu, Shiro Dhara and Shiro Basti. So when this is the Kramat, Abhyanga is first, then Shiro Pichu, then Shiro Dhara, then Shiro Pichu, and finally Shiro Basti. So Shiro Basti is also useful, but only thing is the hair should be removed to Shiro Basti. That's why many patients will not agree. Puncturing the head is essential. It is the only problem in doing Shiro Basti. Otherwise Shiro Basti is a very good procedure for nourishing all the areas. If you give Virechana, what it should be will be there. Then if you do Shiro Basti, Virechana is sufficient. Normal is not required because Pitta Dara Kala and Majja Dara Kala has even a close relationship. So you are giving Virechana for Pitta Dara Kala, brain is there. So Majja Dara Kala is in brain, no, so it will also have the effect on it. So Virechana, after the Virechana, if you give Basti, Shiro Basti, definitely very useful Shiro Basti. I have seen one patient, I have given Shiro Basti for some other reason, that some mental afflictions, that's Mansika Vyadi, we have advocated Shiro Basti for a ophthalmologist. It's a modern ophthalmologist. But after doing Shiro Basti, his eyesight is improved. It's an incidental finding. No, it is not done for that. For mental afflictions we did it. But his eyesight is Shirodhara, one thing I will tell you. Shirodhara not only by snehas. Shirodhara, Takradhara can be done. Takra is Ruksha. Takra in Amalaki is also, see, think that Amalaki is Ruksha Dravya. Amalaki. Karaka has mentioned it is one of the Ruksha Dravyas. Amalaki Takradara, wherever in the Shiras, if Kapahara treatment is required, you can use Amalaki Takradara. Don't think that it is Kapakara Amalaki. It is Rukshana Chikisa, Amalaki Takradara can be. Then even Taladharana, if Takradara is difficult, Taladharana. Taladharana is the Amalaki Talam. Amalaki Talam means the dehusked amalaki, one fistful of amalaki is immersed in buttermilk and cooked, kept overnight. Next day it is triturated and applied over the shiras. So this is one method. In summer, no need to cook it, just mix it with the milk and you can apply in summer. In other seasons it should be cooked, otherwise patient will get pratishyaya. In rainy season or in a cold season if you kept directly. So it should be cooked in rainy and winter seasons, whereas in summer season it's directly mixed with the amalaki and it should be kept over the night. Only in daytime you should put, not in the night time. By 10 o'clock if you put, and by 4 o'clock you can remove it. Amalaki tala. If you want some Medgira science along with that to nourish the Indriyas, you can, while preparing the Amalaki, I did one with the Madhuyasti Kshira. You can make it as Dadi. Then you can make it Takra and you can use Madhuyasti among the Chatur Medgira Sayanas. It will give wonderful result. Madhuyasti Siddha Kshira, it is made into curd. That curd is turned and buttermilk is prepared after. That buttermilk is used for Amalaki. Madhuyasti Siddha Kshira. Kshira means Kshira Paka method, you have to prepare it. You make it, you do curdling and it will become curd. Then curd, equal quantity of water is used. Here Amalaki Kashaya you can use and you churn it and butter is prepared, buttermilk is prepared after. So it is fortified with Madhuyasti. It's also very useful in doing the Karpana to the Chiras. Taladharma, yes. This is a method of preparing the Takra. Even Dara also you can use. It. So Shiro Kichu, then Shiro Basti is over. So Basti, how much you have to do Basti, the duration, you nourish the Shiras. So you will think again Majja Dhatu. Minimum 50 minutes, 53 minutes we have to do. 53 minutes. If you calculate 10,000 Matra Kalas, it will come 53 minutes. Duration of the Shiro Basti. Shirodhara also you have to do, madam, one murta you have to do, 48 minutes. By 10, 20, 30 minutes it will not give good result. You have to make 48 minutes. Madam asking about the diabetic retinopathy, no? We did one research on this Talapatichil, I told you, no, Amalaki Taladharana. We took all the diabetic patients, those who are above 8.2 HbA1c. And on and around 1.5 HbA1c was reduced by 21 days of Taladharana. Within 21 days, 1.5 HbA1c was reduced. Just we have not changed any modern medicine, anti-diabetic drug. Whatever they are taking, let them continue with the same medicines. Only we did Taladharana for 21 days. I have guided the thesis. 1.5 average mean HbA1c was reduced. No, nothing, no Ayurveda intervention, only Taladharana. See how the negative feedback mechanism is very important in containing the diabetes medicine. Because see, glucagon and insulin balance has to be taken place. No, it is by the brain only. If brain is cool, then the balance will be more.
So it's a placebo action or it has some...
It is not placebo action. See,
we have the drug over the weight.
yes, sir.
Yes.
See, I will tell
And
you.
there is somewhere else. So how
Sir. See how the glucose is maintained. There are two hormones. One is insulin, other one is glucagon. So it will get the stimulation from the brain only. When the blood sugar level increases, brain should tell them to release the insulin. If it goes down, then it should give the message to glucagon to release. So this feedback mechanism is there. No, it should be corrected from the brain only. Not directly to the organs.
So it means it's a psychosomatic disorder and we are
Not retinopathy. No, diabetes. Not retinopathy.
So
it's in diabetes.
Sir, so we can consider that if it's a psychosomatic disorder, diabetic is a psychosomatic disorder, we have corrected the psycho part of the...
Not psycho. Not why you take psycho.
Sir, what is the age of the patient?
No, different age groups we have taken, sir. Different age groups. The 30 subjects were taken.
And we can repeat the same treatment if required after how many days? First, we have done one time. Then, if there is a gap is required,
Taladharanam 21 days we did. With the repetition we have not done. Follow-up has to be done. Follow-up has to be done. How it will be sustained? How many days it will be sustained? See, it is a 3 months mean no HbA1c. Even after 21 days means it should be more than that. Otherwise it will not come mean 1.5. Because 3 months average, no. We have not given an Ayurvedic intervention orally, madam. Whatever the modern medicine they used to take anti-diabetic drugs, same is maintained.
No any dietary changes.
Dietary changes already they are diabetic, they know, no madam. No, obviously there is no different, they are not used to consume sweet, fat materials. Then we will Murdni Taila is over. Next we will come to the Kavala and Gandusha. Kavala and Gandusha. So in Hina Mityati Matrakam, Ati Yoga, Hina Yoga and Mitya Yoga. So nowadays because of more watching the mobiles and the computer, the dry eye syndrome is there. No, dry eye syndrome. I think what you are doing in dry eye syndrome, internally Snehana you are giving?
No, sir.
Then
Only Netra Tarpada.
Netra Tarpada. Okay, you are directly doing the eyes, no? I have treated some school teachers. So with the Sneha Gandusha. Sneha Gandusha, see Gandusha means holding the medicated oil. Along with not entirely oil. You put just 2 teaspoons of oil along with warm water. Hold it in the mouth, full mouth, and you should hold it like that. Till you are unable to hold it, usually 10 to 12 minutes one can hold it. 10 to 12 minutes. Then they cannot hold it, they have to spit it out. 10 to 12 minutes, average minutes they can hold, we got it in the subjects. So holding Sneha Gandusha. Sneha Gandusha definitely it improves the dry eye syndrome.
So 2 tablespoons of oil.
Medicated. I used the Ksheerabala Taila. Ksheerabala. Along with warm water only. Just hold it.
Now this is full.
Yes. This is a dry eye syndrome.
Long way back.
So Gandusha and Kavala, they are also very useful. Then Dhumapana, see Dhumapana, we can take it in a wider sense. Dhuma is not only just smoke, even taking steam is also a type of Dhumapana. It's contraindicated in Timira. Then Lepa, Alepa, Pradeha. These are the three important procedures. I think you have done it. Lepa, Alepa and Pradeha. So Alepa is always, it is Ardra Mahisha Charmavat and opposite to the Romakopas. It should be applied. Very important. Opposite to the Romakopa, and it is Ardra Mahisha Charmavat means minimum half centimeter thickness it should have. 5 to 6 millimeter thickness should be there. And Pradeha is also similar thickness is required. And the Lepa is just like Chandana Lepa. Chandana Lepa, how much one puts the Chandana Lepa, that much is Lepa. See where this Lepas has to be done. See, Vatadrute Nasti Shula. Any pain condition is there, then involvement of Vata is there. Vata, only thing, Vata either Dhatu Kshaya or Margavarana. Either Margavarana should be there or Dhatu Kshaya should be there. So Margavarana means what type of Margavarana? Immediate, see if somebody hits us, we will get immediate pain. That pain is Margavarana Janya pain or Dhatu Kshaya Janya pain. It's a Margavarana Janya. So any injury, trauma is Raktavarana Janya Vata. It gives pain. Immediately Raktavarana Janya, what is the line of treatment says? Shitala. Shitala Kriyas. Shitala Kriyas, you put ice. You keep ice, no, immediately. So when after next day, it will be converted into Pittavara. Immediate acute stage, it is Raktavara. Then next it will become Pittavara. In Pittavrata, what we have to do? Remove the Avarana. What we have to do? We should not give, not Chitara again. Say Pitta, Dravasveda is indicated. Dravasveda we can give. Niragni Sveda we can give. Niragni. There Upana, Pradehas I told no. Pradehas can be Niragni Sveda. Agni Lepas we can. Niragni Sveda. Not direct Sveda. Only Dravasveda is indicated. Dravasveda, Niragni Sveda. Then
He told that when there is trauma, so we put ice. Ice is the Sital Gun, means it will increase the Vata dosa.
No, वाता दोष ऐसा नहीं है सर. आवरण के ये रक्त से आवरण हो गए ना.
So Sital Gun will also cause the avarna. Vasoconstrictions it will cause. And there is one Ruksha Sital Gun, which is Guna of the Vata. So it will again increase the Vata dosa, means pain will increase.
No, sir. Pain immediately pain will subside only. So disease is not cured there. I told you no, it will be converted into pitta then. Then finally, see, when it becomes chronic, any inflammation, chronic inflammation, then leukocytosis will be there in the area. Then it becomes so kapha. There you need Svedana. Prabhuta Svedana is required to remove the avarana.
Because this question by
In chronic inflammation conditions, you should take it as a kaphavarana. In the recent inflammation, pittavarana. In the acute inflammation, you should take raktavarana. So this is in the pain management. It is in the pain management. Anywhere in the pain management. If you do like this, you will get a result in ayurveda. So for the pain. So remove the avarana, and after that you see rakta mokshana you can use. Because see, it is not curing the disease, only to have the management of the pain. It is not curing the disease. It is only to maintain the pain management. So why it has came? Because of this alepa, pradeha and this one.
Because this question was asked by Professor Dr. M.S. Patel sir. Here we are sitting in the memory of that. This all have been made. So this question was asked in IPDPRA and still it is unanswered.
This is in practice, sir. What I have understood the Shastra, I have told everything here.
So these oils are actually Shidra Dravya. Does it mean like Shira Chandana? Those are the Shidra Dravya to be applied in Petla water, may not be oil.
Yeah, it is generally I have told, not for the eyes, even eyes, alepa, pralepa and pradehas. Wherever you do, not just think that above the eye, Pakshma Vyadis also there, no, Upanaha Sveda is also indicated. Upanaha, even Niragni Upanaha is there. Niragni Upanaha is nothing but Pradeha. Pradeha is Niragni Upanaha. These are the, I think you are all familiar with this myopia, Akshitarpana and Nasya. You are doing it, no? Akshitarpana and Nasya in myopia. These are the regular procedures, no? Then anterior uveitis, Raktamokshana and Shirovirechana Nasya. Then glaucoma, Nasya, Tarpana, Jalokakarna. Then diabetic retinopathy, Panchakarma. Then Bell's palsy, Sarvanga Bhyanga, Svedana, Nasya, Vaidusha. They are all done. And finally, the discussion, Panchakarma plays a crucial role in the management of Netra Roga. So while doing Panchakarma, we should adhere to the standard operating procedure. SOP is there, Panchakarma SOP is already published by CCRAS. You can get that book. So Panchakarma SOP is published. You can use it. So systemic dosha dushti also to be removed. That dosha can be removed by the panchakarmas. Hence, disease-free state can be achieved by using the panchakarma along with all your shalaka procedures. So with this, along with the Kriya Kalpas, what you are familiar with this, if you adopt the Panchakarma procedures, definitely you can get better results. So what I feel is one among the Ashtangas of Ayurveda, Shalakya, goes with the Panchakarma, definitely for the benefit of the public at large, the patients at large, definitely it will be beneficial. Whatever the study of Panchakarma has taken place in the Shalakya department, a co-guide from the Panchakarma department can be taken. Then in tandem you can go. So it will be more beneficial. With this opinion, I conclude my presentation, the first presentation.
Thank you so much, sir, for sharing your valuable insight and knowledge with us. Your session was truly informative and inspiring. So now it's time for question and answers. Feel free to ask any queries you had.
Sir, initially you said that one is not getting disturbed, you know. So how can we identify a patient
By taking history, you can ask whether in lifetime you have vomited once or not. People will say, how are you feeling nauseated or vomited in Dibasa Darshana, like that, or traveling or somewhere, any food poisoning. Once or other time patient was experienced it, they will say, I have vomited. Switch on it. Now.
Sir, how to use Amadho and Anguda? Any yoga?
Dhamargava. Yes, Dhamargava and yogas are there in Kalpasthana, it is there. But in selecting the yogas, that Shira yogas, I told you know, Shira yoga, Dhruta yoga, and Lehya yogas. These yogas are there. You can select those yogas. And see, there are 24 Shirovedechana Dravyas are mentioned. Shirovedechana Dravyas are also Vamanopaga Dravyas also there. For example, Yela. Yela is in the Shirovedechana Gana and also in the Vamana, Vamaka. So you can fortify it when Damargava is used, no? Along with that, you fortify it with the Yela, so that it will remove the doshas from Urdhva, Shirovedechana. That's one subtle point we can use.
कौन सा
Sir, any prediction
क्या बोल रहे
in practice we
हैं
are
का बोले थे
Root and Pavara Mula is not prediction.
हाँ.
So other than that, any practically
Danti is the Tikshna Virechana. Danti is directly indicated in Madhumeha. In other conditions we say Prameha, no? In Madhumeha, Danti Virechana is indicated. Danti is the Tikshna Virechana.
So what about the dose, sir? Because we have given only limitations.
No, we are doing one research on the Danti in diabetes. Danti Virechana in our college Panchakarma department. The dose is mentioned in the Shastra, no? It is excessive. So we have reduced it to half.
सर धूमपान ना यानी धूमपान also you have finished covered.
Dhumapana we will mention in Nasa and Mukaroga. Because actually direct smoke is not good. We will come to that. In that I will come.
Like if we
patient comes to spot,
that's good.
Madhu Tailika Basti actually. So, in Panchakarma, Madhu Tailika Basti is very good.
there are different stages, like
Stages.
You want to someone also discuss?
No, he is asking in different stages how to be like if there is bleeding,
there are different kind of reasons.
NPDR stage, then PDR stage.
I have given some examples. So you have to make up whether bleeding stage is there, Rakta Pitta type issue. If blockage is there, you have to go to Vata Rakta Pitta. Like that. And if Rasayana is required, you have to give Rasayana. Shilajitra is the best Rasayana. Some diabetics you should use Shilajitra. Utrap is degeneration. Then Rasayana is Daspuchaya हो गया ना रसायन because all the diseases are not sadhya. In our shastra also we have mentioned there is some limitation is there, but the dosha pratyanika chikitsa will give at least little benefit. Definitely if you go for panchakarma, at least little benefit will be there.
Sir,
Then one more I told you know, it is the Indriya where Daivavyapasya Chikitsa also required. Just Yuktivyapasya Chikitsa is not sufficient.
can you, sir? Sir, you said we can give Basti in diabetic retinopathy, but Basti is contraindicated in Prameh Chikitsa. So how it will help in alleviating dosha in Netra while giving the Basti for diabetic retinopathy?
What you told?
Sir, Basti is contraindicated in Prameh.
No. All see, generally there is a, but there are some states which can be indicated, no?
What type of Basti we can give for diabetic retinopathy?
Churna basti is indicated in diabetes.
Sir,
Churna basti is there, no?
okay, sir, what view for churn?
Usually they say Niruha, no sir?
Kirata tikta ka age churna basti. Kirata tikta ka age churna basti is indicated in diabetes.
Sir, how to do this food?
But I have heard that.
Huh?
How to do this food? How can we do that?
I gave it details, no?
Actually they say only Kashaya Basti, Niruha Basti only should be given diabetic patients.
Kashaya is there. It contains Kirata Tikta, Gudochi, Bilwa, Purana Gugudu, Haridra, Amalaki, Darpa and Sada Pushpi. This Churna Basti. Madam, Kirata Tikta ka the Churna Basti contains Kirata Tikta, Gudochi, Bilwa, Purana Gugudu, Haridra, Amalaki, Darba and Sada Pushpi. This Kashaya is given without Madhu give anything, only this Kashaya is given. Yes, given. This is called Churna Basti. Here Kirata Tikta is 7 parts and all other ingredients are 1 part. That's why it is called Kirata Tikta Kadi Churna Basti. Here I have seen diabetes is what we can say.
Sir, what is the reference of this Kirata Tikta where it is mentioned?
Question answer. इसको अभी चाहता नेक्स्ट सेक्शन में ले लेंगे इसको